Madam Dr. Sunita Verma.
We are not related, just in case somebody accuses of hypocrisy and nepotism.
Yes. I should have said that, I think. So now, ma'am, as a group head R&D in the Ministry of Electronics and IT, what message would you like to give to the audience regarding the latest advancement in medical field and how the government and particularly your department could facilitate that, ma'am?
Okay, thank you. First of all, I would like to thank Dr. Prem Agarwal for inviting me here in this session. This was more of a knowledge gaining from me as a non-medico year from the electronics engineering side than from the medical side. But the panelists before me and here also have been talking about AI and the interventions of ICT in the medical field, because now you cannot think of any medical diagnostics, predictions or interventions without the electronics or IT or the devices. We talk about precision, we talk about predictions, we talk about analysis with the AI tool. We have number of AI tools. As head of the R&D in the Ministry of Electronics and IT, what we are aiming at is developing our own indigenous solutions. And in AI, if you we all understand that data is the most important factor for the prediction or precisions. We even talk about personalized health, digital twins, where we look at, the people are looking at, especially I know in diabetes, at least a digital twin of a person to actually have the specific diagnostic and treatment. And this is possible with the tools and the data about that person. There are globally tools available, but for the Indian demographic system, it is the Indian data which is very important. There are globally companies which are coming to the country, taking the data, developing tools. It is the time where we have to develop our own tools using our own data, because the data of the Indian origin people, and also it's not only Indian origin, we are doing research based on maybe northeast specific population or north specific population or South India specific population, so that we get very precision and precise analytical tools. Having said that, our ministry has an AI mission. We are the nodal agency for AI, and healthcare is one of the sectors which has been identified for the AI research, and creating the data repository for the various ministries, including health, is one of the aims that we have. This data repository will be used, after the annotation and sanitization of data for the researchers, so that the Indian demographic data can be used by our researchers for the research and developing tools which are specific for the Indian community or Indian population. So that is a major program that has been recently started, cleared by the cabinet. And I am in charge of the medical electronics and health informatics also in the ministry. So we are having various indigenous measures for developing our own diagnostic and medical equipment. We have recently started with the 1.5 Tesla MRI, the linear accelerator for radiotherapy treatment, ultrasonography machine, blood irradiator system. Then we have cervix scan systems. So it is an import substitution that we are looking at, and and the funding is done by our ministry. I have a kitty of around 1200 crores. Somebody was saying that we are short of research funds. ICMR is funding, DBT, Department of Biotechnology, Ministry of Health. We are working in sync with all of these ministries for funding. So my own funding is around 1200 crores per year annually for research, which includes medical research. So there is no dearth of funding. It is the coming out with the right application or the solution to the problem statements that are seen is what is important. And I think that we need to do that. So I have a lot to say, but I think in the interest of time and for other panelists, I will just stop here. Thank you.